Hi, Dr. Tracy, board certified general pediatrician. And this was a great comment I got on one of my videos about how do I feel the high demand impacts my ability to spend quality time with my patients and their parents. And what do I do to try to make a dent in this? So this is a really interesting question. So I actually did a little bit of reading about this, about is it really true or is it perception that we have? And what is actually true is that the amount of time in a primary care visit has actually gone up over the last 20 years. But the number of problems that are expected to be addressed during that problems have also doubled. So while there is a little bit more time face to face in most primary care visits, the reason that there is the feeling that there is less time with your provider is because there's more problems to be addressed, as well as people go to the primary care provider less often due to a few different factors, such as increase in costs, transportation, wanting easier access such as telemedicine or urgent care. And so when they go to their primary care provider, they may only see them that once or twice a year, so that connection isn't there. They haven't seen them over and over and over again. Another thing with children is that while chronic illnesses have increased in children, overall acute visits have gone down, so they are less sick by infectious disease because of vaccinations, so we don't see them quite as often. And sometimes because of cost, because of parental preference or availability of their provider, if they're holding all of the problems in and then come into a wellness visit, there's no way that 20 minutes is enough for that. So you feel as if you can't get everything done in that visit. There's also a lot in general pediatrics, at least, where because of the increase in chronic illness, we are doing a lot more deep diving into the real causes of those things. So we're having to ask a lot more psychosocial factors, environmental factors, risk factors, screening for depression, anxiety. We're treating so many different things because of the increase in chronic disease that it's much more complicated, whereas an ear infection is pretty quick. And while those are down in children, the amount of chronic disease is up. So I think there's more to cover in the room, which probably makes the patient and their parent and the provider feel as if there's not enough time to really make that connection. So I think there's a lot of different factors that contribute to this, but I did find it interesting that the actual amount per time of your visit is up. It's just the number of problems is also increasing. So one of the ways that we try to combat this a little bit in my state as well as in my practice, and then I'll talk about myself personally, is up until 2026, the state of Vermont where I am has a capitated healthcare system for primary care, and there are other states that do this as well. But our system is set up to where primary care is supported per patient life that they're responsible for. So if someone is assigned to my practice and I have around 8,500 patients, I get a small amount every month to be responsible for that patient. I'm not paid per visit. And so it's not about how many times you come in, it's about wrapping around supportive care. So that steady amount allows me to not feel the pressure to bring someone in all the time. It also allows me to keep my business going more consistently. And then I can offer things like really high quality after hours care. I can offer telemedicine, which is really no charge. We don't get a charge for telemedicine mostly in our state. It also allows me to have mental health counselors and registered nurses on the phone and a case manager. So we have a little bit more wraparound supports for family. So while the amount of time with me may have gone down, the amount of healthcare time in my practice specifically has gone up because of that support. So that's one way that we have gotten around it. That is going away, sadly, at least for now. We hope something replaces it. And so we're working on ways to, if we have to go back to that fee for service model where you just paid per visit, how do we still keep those consistencies in care? Other ways that I personally manage this is that I do better when I don't have an electronic medical record that I'm trying to navigate while I'm in the room with you. And so while I may show you your growth chart or look through things, make comments about it, I'm not doing my note while I'm in the room with the patient, because I really feel like I do better as a person when it's just me talking to the family. And I may only have 3 or 4 minutes, but that 3 or 4 minutes is much more helpful and probably beneficial in a lot of ways if I'm able to make that eye contact and I'm sitting there facing them with my legs crossed and like really talking to them about what's going on. And so while that is harder for me as a person because my notes are having to be done during off times, that's why a lot of your providers don't do that because they're trying to have a work-life balance. I find that it is better for my visits. And I think in general, most of my patients feel that I am listening to them and hearing them, specifically because I'm not on the electronic medical record. We all also now are trialing, and a lot of people already have this, which is AI for doing your notes for you so that you can have that work balance. The notes are really accurate, but you're not even having to touch the computer while you're in the room. You're able to just have that one-on-one with family. So that's some of the ways that I handle it. I also do a lot of advocacy work where the policies that we have make a difference in the exam room. And so trying to get more involved in that where I don't just accept what it is, right? Because none of us have to accept this. We can all make a difference and we can all say this is not acceptable to us. Healthcare should be a right, and we should find a way that primary care offices can stay in business but also provide the amount of care that people actually need them to do. So great question. Thanks for asking. If anybody has any follow-up questions, let me know. Take care.